I do understand why so many people stretch their hamstrings when they're suffering with sciatica pain, because often it does feel good in the moment. However, what you're doing is actually increasing your problems in the long term instead of finding solutions that are going to help to decrease your pain over time. Now, I know this is super controversial and that there are other people on YouTube who are telling you if you have sciatica pain, you need to be stretching your hamstrings. However, if you've been stretching your hamstrings and you've been suffering with sciatica for more than a week and it's not getting better, then maybe this video will be helpful for you to explain why you should not be stretching your hamstrings. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I also hold a PhD in orthopedic manual physical therapy, which means I spent 6 years after PT school studying the human body and how it works. I am literally a doctor, and I am also an expert. And I have gotten really frustrated with so many people being told to stretch their hamstrings when they have sciatica pain, which is the exact opposite of what they should be doing. So today we're going to discuss why that's such a problem in the first place, as well as what you should be doing instead if you're suffering with sciatica pain. First, let's start with a little bit of anatomy. So the hamstrings originate or start on the ischial tuberosity, which is right here. That's your sit bones. So when you're sitting down and you feel those bones, one on each side, that's where the hamstring originates. It covers the entire back of your thigh, and then 2 of the hamstring heads insert over here. So this is your tibia. So it goes all the way across your femur and attaches in on your tibia, and then 2 of the tendons attach on the other side of the tibia. So it covers the entire femur. Now, the thing is, the sciatic nerve is traveling through that hamstring. So it comes through the pelvis here, and it comes out. There's a hole here, sorry. It's really hard to tilt him to be able to show you that, but you can kind of see how my finger's coming through here. So that sciatic nerve comes through there, and then it will travel down the hamstrings, and then it'll actually end up splitting down in here, down on the outside of your shin bone. So any time that you are stretching your hamstrings, you are also stretching the sciatic nerve. Now the thing is that the hamstrings are a muscle and they generally like to be stretched. However, nerves, and they do not like to be stretched at all. The challenge comes in the fact that they may not say anything about it right away. So you may stretch your hamstrings and it actually causes irritation of the sciatic nerve, but it doesn't feel like that immediately. It just happens over time. So what happens is you stretch your hamstrings and then the sciatic nerve gets irritated later on, and you don't necessarily put that correlation together of I stretch my hamstrings and my sciatic nerve is activated later on, because it doesn't make sense. It seems like it should happen right away, and I do understand that, and that's why a lot of people really struggle with this, is because they're like, well, I stretched my hamstrings, but my sciatic nerve pain then went away for an hour or 2. In that case, what happens is that it's almost like the sciatic nerve is kind of overwhelmed and it just kind of taps out. So it can decrease the pain for a short period of time, but the nerve will end up more irritated because of the tension that's happening back here. But the nerve will end up more irritated in the long run. Now, a lot of people will ask me, okay, well, can I stretch the other muscles in the hip? It's fine to stretch any of the muscles in the hip that are not innervated by the sciatic nerve. So the nerve does not go through them, nor does it supply nerve input to them. So now this would be more the muscles on the side of the hip or the front of the hip, and even stretching those can help to loosen up the hip overall and decrease your sciatic nerve pain. So how do you know if you have a hot sciatic nerve that should not be stretched? If you are having any shooting pain that is going down the back of your leg, you do not want to be stretching that. Also, if you are having any difficulty sleeping. So some people will have decreased symptoms during the day when they're moving around and when they're active, but they get a lot of pain at night and it can interfere with their sleep. If that's you, then you definitely do not want to be stretching the hamstring. In that case, the nerve is hot and it needs to be calmed down. And those are the techniques that we're going to discuss here. Before we move on though, there is one caveat to this, and that is phantom sciatic pain. Phantom sciatic pain is what I call the pain that runs down the back of your leg that goes along the same path as the sciatic nerve. However, it's not a sharp shooting pain. It's more of a dull, achy, tensiony, I feel like I want to stretch it kind of pain. That's what I call a phantom sciatic pain. It's along the path of the sciatic nerve. However, it's not that sharp, shooty pain that we normally associate with sciatica. If that sounds like you, I'm going to have you go check out this video here where we discuss that more, because that treatment is going to be different for you. Okay, so you have a hot, shooting sciatica pain and you want to know what to do about it. The first thing I want you to do is put some ice on it for 3 to 5 minutes. Now, many people ask me, where should I put the ice? And here's my best advice. I would start by putting the ice on your low back for 3 to 5 minutes, because that's where the sciatic nerve starts from. You see, it starts from nerve roots that come out from the spine and join together to actually form the sciatic nerve. So it's always good to start at the source. However, if you're having sciatic nerve pain that's going down your leg, then go ahead and put the ice for 3 to 5 minutes on each location where you feel pain. I always explain that you can use the ice to chase the pain. That's not a problem at all. Use it on as many different locations as you need to get that sciatic nerve to calm down. Now, how frequently can you do that? You can do that up to every hour, and that may be necessary when you're in the really hot, inflamed stages. The next thing I want you to do is get up and start walking gently around the house. Now, I know a lot of people will say walking significantly increases my sciatica symptoms. And that does have to be balanced, because in general, I don't like to recommend doing anything that increases your symptoms. So if you stand up, which may at this point increase your symptoms anyway, I only want you to walk as far as you can without those symptoms increasing from that point. So let's say you sit. Some people have no pain when they're sitting with sciatica. Let's say that's you. You have no pain when you're sitting with sciatica. You stand up, it becomes a 7 out of 10 pain. Then I only want you to walk around the house for as long as you can without that pain moving up to an 8. And then probably what you'll want to do is walk to the freezer and grab an ice pack so you can go sit back down and get some ice on it. As you start to feel better and things start calming down a little bit, you can increase the lengths of your walk and the time that you're walking. So you may go from around the house to around the block to actually being able to go for a walk for a half mile and then a mile and then 2 miles. The important thing is everybody wants to know, how long do I walk each distance? And the truth of the matter is you only want to walk as far as you can without your symptoms increasing from the pain you had when you first stood up. You've got some ice on it, you're walking around the house slowly and gently. The next thing I want you to do is to make sure that you're hydrating. Drinking water is super important to make sure you're cleaning out that inflammation around the sciatic nerve. So I'll give you 2 different ideas. One, if you're really by the book and you want to know exactly how much water you should be drinking, you need to be drinking a minimum of 80 ounces a day. And that may sound like a lot of water to you. That may not sound like enough water to you. Everybody's different on where they're starting on their hydration journey. However, if you need a number to shoot for, I need it to be at least 80 ounces a day to make sure that you're able to wash out all that inflammation and decrease the irritation that's surrounding the sciatic nerve. Now, what I prefer to say, because I feel like it's a more accurate statement, is you want to drink enough water that your pee is clear, and then drink enough water to keep your pee clear. And friends, let me tell you, that's a lot of water. That tells us that your body is well hydrated and able to do the healing that it needs for your sciatica pain. Now, on our journey of calming down that sciatic nerve and getting everything more relaxed, we want to get into a normal posture for us. Now, this is difficult for some people because they want to know exactly what posture should they be in. Now, the ideal posture is you want to have your head on top of your shoulders and your shoulders on top of your hips when you're sitting. And of course, when you're standing, then you want your hips on top of your feet. Now, some people who are struggling with sciatica simply can't get into this position at this point because it's so painful. So then you need to get as neutral as you are capable of, again, without increasing your symptoms. I don't want to recommend that you should be in this really specific position because it might be a position that is actually aggravating for you right now. But getting to that goal of head on top of shoulders, shoulders on top of hips, if you're standing, hips on top of feet, will give you something to shoot for. Now, no video would be complete if we did not talk about sciatic nerve flossing. So many people are asking me if it's safe to be able to do flossing. And what I can tell you is that if you are doing flossing, most likely it is actually increasing the tension to the sciatic nerve and increasing the inflammation around it, which is going to prolong your symptoms. Here's the idea with flossing. The idea is that the sciatic nerve is getting tethered down at some point along its path. So we discussed earlier how it starts in the lumbar spine, the nerve roots come out, form the sciatic nerve, it goes to the hip, down through the hamstrings. On the outside of the knee, it splits into two branches, one that goes down the back of your calf, one that goes down the side of your calf, and it innervates your foot. That's a really long path. Think about it, all the way from your low back to your foot. So it does make sense that somewhere along that path it could get tethered down and that could be causing your irritation. However, if you don't know the inflammation source, that plan can backfire. So many people are actually having sciatica because of a problem in their low back or in their SI joint. So one of the higher areas, and then when you do the flossing, it actually irritates those areas, which increases your sciatica symptoms. Now, if your sciatica symptoms are only down like behind your knee or down in your calf or even in your foot and you have no symptoms in your low back, you could try flossing and observe how that works for your symptoms. But again, remember what we said at the beginning of the video. The sciatic nerve initially will not respond to the flossing or the stretching. It will happen over time. So you might not see symptoms for 1 to 4 hours later. So if you're going to do the flossing, please make sure that you're doing it in a scientific way. I understand it's an N of 1, but you want to see what it does for your symptoms. So write down what your symptoms are before you do the flossing, and then keep track of what those symptoms are for the rest of the day compared to a normal day for you. Because maybe your brand of sciatica does actually respond to flossing, but not all of them do. Every body is unique. Now, I do understand if you are dealing with sciatica, you want to be doing as much as you can to heal it as quickly as possible. And this is probably the most challenging part for people, especially when they're dealing with a recent onset of sciatica, is they're looking on YouTube and they want to find out, what can I do to get rid of this? And then they end up doing a lot of things which actually may be making their symptoms worse. So if you recently started suffering with sciatica symptoms, I want to encourage you that slowing down can actually speed up your healing. Calming down the body, calming down the system can actually help to improve the state of your body so it can actually heal, decrease that inflammation around that sciatic nerve, or deal with any other structures that are putting pressure on the sciatic nerve. If you let your body calm down a little bit before you start any stretching or strengthening exercises, it will pay off dividends in the long run. It is really important when you're having any type of pain to make sure that you're listening to your body. Try adding something in and see, does that help to decrease my symptoms over time? Not just right after you do it. Obviously, it should help decrease your symptoms right after you do it, but then also over time, does this seem to be helping me get better? All right, I hope you will join me in the rebellion and stop this insane stretching of your hamstrings to cure your sciatica. I guarantee you it is not helping you, and it's probably making your sciatic symptoms last longer. Choose healing over habit, or what everybody else is doing. And remember that movement is life, but it has to be the right movement. If this video was helpful, please give it a thumbs up. Don't forget to click subscribe. And if you're looking for more sciatica tips or things you can do to actually eliminate your sciatica pain, I'm going to have you check out this video right over here.